Honorable Kazembe right here, so that they'll be there to answer your questions if you have any. And then right behind me, I do have the Professor Mavima, the Minister of Public Service, Labour and Social Services. And do I have my Permanent Secretary right behind me? Good. So today, Cabinet considered and adopted a report on the country's preparedness and response to the COVID-19 outbreak. This was presented by Honorable Vice President KCD Mohadi as the chairperson of the ad hoc interministerial task force on COVID-19. Cabinet noted the increase in the total number of COVID-19 tests hitherto conducted. These had risen from 13,329 as at 5 May 2020 to 23,096 as at May 10, 2020. The country has to date recorded 37 COVID-19 confirmed cases, inclusive of 12 recoveries and 4 deaths. Government remains cautiously optimistic that the low rate of deaths and infections that the country has registered to date remains stagnant. The country should not take this apparent low rate as a sign to be complacent about, but should continue with a unity of purpose and determination exhibited so far. Cabinet notes that currently there is no vaccine or cure for COVID-19, and the most effective weapon against this pandemic are preventions and precautions. To this end, all citizens are encouraged to wear face masks, and you have to wear it properly, practice good hygiene and other protective measures. With regard to the situation where companies are experiencing difficulties in assessing rapid results test kits for testing their employees in compliance with the requirements of Statutory Instrument 99 and 103 of 2020, Cabinet directed that, pending the acquisition of the requisite test kits, companies should, in the interim, be allowed to open, subject to adherence to the following conditions in relation to their employees. A, handy sanitization upon entry to workplaces. B, temperature tests on entry to premises. C, mandatory and appropriate donning of face masks. And D, enforcement of social distancing at the workplace. In the event that an employee manifests a body temperature which is above that which the Ministry of Health and Childcare considers safe, such employee shall not be admitted to the workplace, but shall immediately be referred to a facility of the Ministry of Health and Childcare for rapid result tests. In the event that the employee tests positive, the affected employee will be referred to the Ministry of Health and Childcare. This notwithstanding, and for the avoidance of doubt, companies shall remain obliged to subject all their employees to the rapid results test as soon as reasonably possible during the period of the duration of the COVID-19 virus as a formidable epidemic disease as prescribed by the Minister of Health and Childcare. Cabinet also stressed the need for all businesses to ensure that workplaces are continuously disinfected in line with the requirements of the Ministry of Health and Childcare. Also, notable progress has been registered in the fight against COVID-19 pandemic. As at 11 May, these include the following: release of Treasury of 27.54 million to the Zimbabwe National Water Authority, ZINWA, and the District Development Fund, DDF, for countrywide borehole drilling and rehabilitation. Then secondly, establishment of fully functional quarantine centers at all ports of entry, with a total of 3,611 returning residents having been compulsorily quarantined as at the 11th May 2020. Then the screening of all returnees by health authorities screening of all returnees by law enforcement agencies to weed out some convicts and those that committed crimes before they crossed borders to neighboring countries. Then finally, the establishment of a COVID-19 command center, which will be headed by the Civil Protection Unit at Crisis Center Makombe Building, and this command center will be there to direct and coordinate all COVID-19 operations therefrom. The command center, which will be operational on a 24-hour basis, will be guided by the following terms of reference. 1, to have regular interface with subcommittees of the Interministerial Task Force on COVID-19 with a view to enhancing implementation of programs. 2, to ensure effective coordination of COVID-19 operations that involve various agents of government and other stakeholders. And 3, to establish and implement an effective communication system for enhanced COVID-19 operations. And 4, to develop and implement a robust logistics framework for all COVID-19 operations. And 5, to analyze reports and prioritize interventions. 6, to identify hotspots and troubleshoot on emerging COVID-19 issues. Then 7, to monitor and evaluate COVID-19 processes and programs. 8, to give feedback and advice to the structures of the Interministerial Task Force based on experiences of the command center. And finally, 9, to compile and submit daily an ad hoc report. Cabinet notes with concern the mushrooming of briefcase companies which are being involved in the tendering process for COVID-19 supplies. Government will leave no stone unturned in ensuring that such unscrupulous business elements are sifted out. Then, in view of the forestated, Cabinet resolved as follows. A, that a risk-based approach testing for the workforce in industry and commerce and other sectors of the economy be conducted and comprehensive package of preventative interventions maintained. B, that PCR diagnostic testing be administered on those who need it and based on proper sampling. Then C, that funds that are availed for the procurement of hydrogeological survey equipment for XINUA and DDF. D, that the metropolitan cities be capacitated financially to be able to provide adequate water supplies to residents during the COVID-19 period and beyond. And E, that the returnees who offer to pay for themselves be allowed to do so on condition that the facility is secure and subject to inspection by health and security officials. And finally, F, that reputable and established companies be contracted to supply COVID-19 materials. Cabinet also approved that in order to minimize COVID-19 exposure risk, they will be looking at the issue of health workers to make sure that their health, their conditions are conducive to good working. The safety of health staff will remain an overriding consideration at all times. Then Cabinet also received a report from Minister of Lands, Agriculture, Water and Rural Resettlement, and this is on sesame seed production and promotion program. The Minister presented his report and Cabinet approved this sesame seed production promotion program for 2020-21 season. The program will cover 40,000 hectares and will produce 24,000 metric tons of sesame seed at a yield of 0.6 metric tons per hectare. The program will provide fertilizer and chemicals at a rate of 4,000 Zimbabwe dollars per hectare. Hence, the 40,000 hectares, the program is expected to cost 160 million. The buying price of sesame seed will be pegged at US $875 per metric ton. That's the selling price, which will give farmers a return of 20% so as to incentivize them to produce more sesame seed. The sesame seed producers would be paid 50% in foreign currency and 50% in local currency. That's the report of the Cabinet today. I thank you sincerely for listening.
Thank you, Honorable Minister. Now we come to a period when we will give you time to ask questions. As usual, we'll have 2 sessions. Session 1, 4 questions, to be followed by session 2 if need be. Any volunteers? Yes, please.
Thank you, Takuchi Mbakwe from Zim Papers TV. My first question is regards the retainees. How prepared is the Ministry of Social Welfare in terms of catering for them? Already we know they are no longer generating income. Are we able to absorb them, given that we already have people in Zimbabwe who are still waiting for their $200 cash payouts? And then secondly, to you, Minister Mtwanga, you highlighted that the testing by companies is now just being done in the shortest possible time. But last week you had said in 14 days' time we need to have all employees working tested. What's the position now? Thank you.
Yes, please.
Effort to secure SABC News. Maybe mine will go to the Minister of Home Affairs. It has to do with, well, I don't know if it's the correct use of face masks, but as we move around the police, at police roadblocks or checkpoints, there seems to be no consistency in what they are checking for or what they are asking for. At some point you're asked to produce a letter, at some point you're asked to wear your face mask even if you're in your own vehicle. Is that the procedure, and can you just clarify as to what we should expect at these police checkpoints?
My name is Leroy Zenga from Derod. I would like clarification on whether the command center, the COVID-19 command center, is the same or is it different from the National Response for COVID-19 Pandemic Office, which Dr. Agnes Mawomba is going to be leading, as has been announced by the recent press statement. Thank you.
Yes, last one. Yes, please.
My name is Maxwell Tapatapa from Star FM. I just want to ask on the issue of isolation of patients. Did by any means government discussed on the issue of patients who are being isolated at home, considering that those people might be at a risk of contracting the virus to the near person, considering that they are not guided, no one is strictly monitoring them to make sure that they don't go out. Thank you.
Can you repeat, please?
Okay, I was saying, did government, Maxwell Tapatapa, Star FM. Okay. Did government also discuss on the issue of isolation of COVID-19 patients? Since there is a risk of those patients, maybe they can decide maybe to just go out for some time. Is there mechanisms whereby government is ensuring that maybe they can establish a center where they can say all COVID-19 patients are being isolated at this center, so that they can closely monitor their steps to prevent the issue of contracting the virus to their neighbors or maybe their kids or some other people?
All right, thank you very much. Thank you for those questions. Let's start with Taku. Taku, as the question was directed to the minister regarding the returnees, Minister Professor Mavima. How prepared are you to look after them, considering that issue of resources to the problem of the ministry have not paid the vulnerable, the monies which are supposed to be paid? Minister?
Thank you, Honorable Chair. The two issues are not connected at all. The first one regarding to catering for returnees. You realize that we have been given, since the start of the lockdown and the fight against COVID-19, we have been given 125 million as a ministry. We may have had some logistical problems here and there, especially this weekend, due to the large influx of people coming through Beitbridge and going to different parts of the country and being placed in provincial facilities for isolation. So because of that, staff from both our Ministry of Public Service, Labour and Social Welfare, as well as from the Ministry of Health and Child Care, were stretched to a point where some of the returnees had to endure some hours of waiting before they could be processed. But we have not lacked resources to look after them in terms of food, in terms of other provisions that they may need. But there's another element to the returnees. There are returnees who are saying we don't want to be in public facilities. We would rather pay and be in more comfortable facilities. And if you look at this matrix from Cabinet, you'll realize that Cabinet has said, yes, if there are those people who want to pay for themselves, we should set up those private facilities, but they have to be inspected by the health authorities and approved before they can take in any returnees. So that has been granted. But you have to understand that we have some of our citizens who could not pay for themselves. So the state has to continue to provide for them. And like I said, we can assure the nation that the resources to look for those, to look after those returnees who are coming in are available to continue to do that. Then the issue that you referred to about the 200, you also realize that we have been tasked by government, by Cabinet actually, to go and look at the numbers and make sure that what we are working with are bona fide citizens who should receive this money under the criteria that we use to establish vulnerability. And we have had to go back at the whole list, and we have so far approved 90,000 to be paid. We continue to look at that database so that we can pay to bona fide citizens. You also want to know that our discussion with Treasury has now raised the figure from 200 to 300. And we should be starting paying these 90,000 that have been verified. But we continue the process of making sure that we validate those people who are on the database to make sure that they are really bona fide. We are not paying, for example, Honorable Kazembe, who is not vulnerable at all, but we are paying Zimbabweans who should receive this under the current program. Thank you.
Thank you very much, Minister Professor Mahima, for answering that question, and I hope that we are happy about it. I say thank you very much, Honorable Mavima, for answering Taku, and I'm sure, Taku, you are happy about the answer. Good. And the next question was about testing of employees by companies. And I want to reiterate that the position has remained the same. And as I say, this is a government which is a listening government, and after listening to the industry and also seeing the situation that it wasn't easy, it is difficult to procure testing kits, we then had to come up with the following, which is what is actually required for companies to operate as we stand right now. And as long as we do have this problem of acquiring rapid results test kits, this will always stand. And I want to repeat that Cabinet directed that pending the acquisition of the following of the requisite test kits, companies should, in the interim, be allowed to open, subject to adherence to the following conditions in relation to their employees. And this is where I talked about handy sanitization, temperature tests, mandatory and appropriate donning of masks, and also the enforcement of social distancing. Then I want to go to SABC, Mr. Msekiwa, and that question is directed to you, Minister Kazembe. And he just wants clarity. He says as they move around the police at checkpoints, there seem to be no consistency. Sometimes they ask about, they are looking at whether you are donning your face mask, and sometimes they are asking for exemption letters. If you can just clarify, Minister.
Thank you, Chair. First and foremost, I need to make it very clear that police are there to ensure compliance with the regulations as prescribed in the various statutory instruments with regards to the lockdown. And with reference to the masks, it is very, very clear in order number 5 that every individual, I'll try and quote the first few lines for avoidance of doubt. Every individual who by this order is permitted to leave his or her home or to be in any public space must wear a face mask. So that is very clear. So even if you are in your car, but when you talk to the police, obviously you are going to open your window. And by so doing, you're in a public space because you're talking to the police, so you should be wearing your mask. And then the other issue you raised was that at times police are not, are they asking for letters or they're not asking for letters? Let me clarify on that one. What this extension entails and what was prescribed in the statutory instrument was basically an extension of the period and an extension of the category of essential service providers, which now include other formal traders and etc. But as for the other regulations and requirements, they still stand. So you still have to prove to the police officer that you are indeed an essential service provider. I hope I've answered you. I thank you.
Thank you very much. Thank you very much, Minister Kazembe. And the next question from Leon from Herald, the command center. As I was reading, I indicated that this was a report from the chairperson of the task force on COVID-19 interministerial committee. And this report, so the issue of the command center I'm talking about is about the task force which recommended a command center which will be operational, which will be actually there and headed by Civil Protection Unit. And this will actually be operational 24 hours and will be, and I've read a long list of terms of reference. This is different from the press statement you are referring to. This is something very different from what I was talking about, if that suffices. Thank you. Then I want to go to the next one, Maxwell, Star FM. And the question was, did government discuss issue of isolation? Is there a mechanism of making sure all COVID-19 confirmed cases are isolated? Worldwide, we are told, and even World Health Organization has come out very clear that 80% of those who actually get infected with COVID-19, they don't need to be hospitalized. There is no, actually, they don't need to be hospitalized. They can actually get it and recover. What is important is they stay at home and isolate themselves from the other members of the family. And this is what the ministry and the government is also practicing. So most of them, those who are only admitted is when they actually have got symptoms which really need clinical help. That's when they get admitted. And just about 5% would need ICU attention. So this is precisely what we are making sure that those who come, even after being screened, found positive, the Ministry of Health itself, the officials, they keep on following that person to their houses, make sure they tell the whole family how to, how they should keep separate in terms of isolation. So this is, and they continue going to make sure that is happening, and that's what has been happening to all those. None of those I think about 21 need hospitalization. They're actually recovering from home. And those 12 who have recovered, they've actually recovered from their homes. Thank you. We go to the next round.
All right, last round. Start with you in the front.
Margaret Matiberi from ZBC. Mine is not a question, but I'm seeking clarity on the companies that are allowed to supply material for use in the fight against the COVID-19 pandemic.
Anna Chibam is my name from newzimbabwe.com. And my question relates to the case of confirmed COVID-19 from the mining sector. We understand there's a report that one person tested positive, and I want to know from government, how soon are you going to make sure that all the people in this sector are tested? Because we have, I think, more than 500,000 artisanal miners in Zimbabwe, both illegal and legal miners. Thank you.
Thank you, Takuchi Mbaki, once again. Minister Mavima, I'm going to put you on the spot. 3 weeks ago, your colleague from Treasury told us in this very room that government had used an algorithm to actually scan and go through all details of people who are going to benefit from this cash payment. And now today, as prices continue to go up, the value of the money is being eroded. And still, we are still verifying details. Don't you think the more we delay, when the cash payments are actually made, it's not going to be worth the wait at the end of the day? Thank you.
Just a follow-up. I hope we have someone from the Ministry of Finance. We have clients who bank with a Standard Chartered Bank, and they've been failing to get their monies. I'm one of those people, and I can't withdraw my salary, which is in Forex, for the past 3 weeks. And they've been telling clients that the cargo planes are not flying, so they have no cash for us. Thank you.
Oh, it was not discussed. Anyway,
I was just going to note and say that's a
but
very specific question. I'm sure the Ministry of Finance will be very happy to answer you outside.
There are only 3 branches around the country.
I can understand your frustration, but we are at a post-cabinet briefing, and we only talk about issues which have been discussed in cabinet. But outside, as a Ministry of Information, we are happy to see you, to talk to you, and we also can actually refer you to the Ministry of Finance to get the rightful information. This is a particular case. Yes. Okay. And the name is? I need to know you more. Anna Chibam. Okay. Do we have 4? That's it? Okay. Sorry.
Margaret Matibiri again. This question is to Minister Mavima. Initially, when funds were released, when the issue of funds being released to assist people who would have suffered loss of income, it was said that these funds were supposed to be disbursed in the first 2 weeks of the lockdown. But then now we have surpassed that. I think we're in the 7th week, and people have still not received these funds. What is causing the delay?
Thank you very much, Margaret. Yeah, thank you. Margaret started off with companies. Which companies? You said your question was which companies are allowed to supply COVID-19 materials. This is being done by the Ministry of Health and Childcare through NATFAM. They've been working also with the task force, which is there for monitoring to make sure that everything is being done well. But for any, if you've got any particular question, you would, I'm sure I would refer you to Ministry of Health. And then in the issues of artisanal, that was Anna, newszimbabwe.com. We would want to say government's intention is to make sure that we contain the spread of this disease. And obviously this is why the president promulgated the lockdown. That was to make sure that people stay at home and then they adhere to the measures of that lockdown. The issue of artisanal miners is an issue which we were very concerned about, and all the provincial task force have actually been looking into how to make sure that they are also safe and they stay at home too. But when it comes to miners who are mining companies who are already mining, my colleague minister here actually visited Unki Mine. Yes, and I will be happy if he can give you what he saw at Unki. Minister Mavema.
Thank you. Our observations at Unki came after a visit, which was a TNF visit. We had the Employers Confederation of Zimbabwe. We also had the ZCTU as well as ZFTU together with government. In many ways, Unki showed us that there is a way in which we can prevent COVID-19 spreading, especially those companies that have the capacity to provide for things like masks, are strict about social distancing, strict about screening through temperature scanning, are also strict about hygiene, sanitization. What Unki has done is to revise their shifts to where only about a third of their people come in at any given time. And they are strict about maintaining a 2-meter social distancing program. They have hand sanitizers everywhere. They disinfect their changing rooms each time a group comes in, and after they have left, they have even given their employees thermometers to take back home. And if they feel that they cannot, they have high temperature, then they don't come to work. Immediately they report to company authorities so that they can be tested. What Unki has also done is they are now in the process of setting up a testing center, a PCR testing center, and they intend to test all their employees in a definitive way. So here is a company that is doing all the right things, almost providing the gold standard of what we should do in order for companies to continue to operate while least dealing with the COVID-19 spread. We went to a different company. I will not mention names. This was meat processing. I mean, they do chickens and they process chickens. We saw almost all the negative things which point to not so serious compliance with prevention. And we have made recommendations for this company to improve on the situation. Otherwise, it becomes a source for spread of COVID-19. At a minimum, government in conjunction with the employers and also with labor should embark on a very robust information process for those companies that have opened to make sure that they are in compliance. Screening, temperature screening, face masks, social distancing, as well as hygiene, washing of hands, sanitization, what do you call it? The more comprehensive kind of disinfection should always be taking place. Even the transportation of workers should observe social distancing. Otherwise, we create problems. Thank you very much.
Thank you very much, Professor Mavhima. And the last two questions, one from Taku and the other one from Margaret, ZBC. They are all concerned about the fact that when these funds were talked about, they were supposed to have been given disbursed within the 2 weeks of the lockdown. And Taku is actually talking about the loss of value of that money, which has been eroded by inflation. And he's saying the more you delay, certainly the weight of that cash will be much less and less. So, Minister Mavhima, you have those two questions from those two.
Thank you, Honorable Chair. The two questions are almost the same. Taku is talking about the delay, and Margaret is also talking about the delay because we had said the first 2 weeks. Earlier on, I indicated that Cabinet instructed that we reinterrogate the database to make sure that we are paying really vulnerable people. And this is what has gotten us back to the drawing board. And like I said, from the original database, we have now verified 90,000 who are now in the process of being paid. We also realize the erosion that Taku is referring to. And because of that, the amount to be paid has been upped to $300 per individual. So to me, the direction by Cabinet to say, go back, look at your social welfare criteria that you use to identify vulnerables, and then use it on this database was really a worthwhile thing to do. And we are in the process of doing that, 90,000 so far, and we continue with that process. I'm going to be whipping the department that is responsible and meeting with them tomorrow to make sure that this whole process is expedited. But as soon as we verify, then we pay. If we verify 20,000, we go ahead and pay those 20,000, so that we don't continue to lose. I mean, the values are not eroded further. So, in my view, it was worthwhile for Cabinet to then direct that, make sure that this database is really compliant with vulnerability criteria that you use on a day-to-day basis. Thank you.
Right, on that note, I want to thank my colleague ministers for being here, Chief Secretary, Permanent Secretary, and our staff. Thank you very much, members of the Fourth Estate, for supporting us all the time. Thank you.
Also, much for me.